Let's go ahead and move forward with Kam Hoi Man from the Shanghai Yaotong University Hospital. And he's going to address the comparison of 4 risk prediction models for diabetes remission after Roux-en-Y gastric bypass surgery in obese Chinese patients with type 2 diabetes. Kam Hoi.
Thank you, Dr. Crow, for your kind introduction. It's my great honor to have a chance to give a speech here. My presentation is about comparison of risk prediction models for diabetes remission after bariatric surgery in obese Chinese patients with type 2 diabetes. First of all, I would like to share the reason that we brought up this topic. Bariatric surgery is now recommended as an effective treatment for obesity and type 2 diabetes. Risk prediction models have been proposed in order to better predicting the post-operative outcomes. We chose 4 most common models for our study that's shown in the right picture. As you can see, each model consists of 3 to 5 clinical variables. Since more of the models have been designed and validated on the base of Caucasian population, our study is focused to verify whether the 4 chosen models is applicable to Chinese population specifically and identify the optimal models for predicting post-operative diabetes remission. Then we start our study by enrolling 253 Chinese individuals. All patients underwent Roux-en-Y gastric bypass and complete a 1-year to 3-year follow-up. We collected the relevant clinical variables for each patient and calculated their score for each model. The predictive performance of the 4 models were based on both discrimination and calibration measures. The discrimination was assessed according to the AUC value, and the calibration was calculated by both Hosmer limit office test and the predicted to observed ratio. This slide shows a brief statistical data between each model. We can notice that the diabetes models has the largest AUC value, with predicted to observed ratio approximated to 1 compared to other models at both 1-year and 3-year follow-up. Overall, the diabetes models showed the best predictive performance. And it has the advantage of easy clinical application because it just needs to collect 3 variables. That's all. Thank you for your attention. If you have any questions, please don't hesitate to raise them up.
Okay, thank you for your presentation. Could you stop sharing your slide now, please?
Oh, okay.
Very good. So I see no questions, but I have one. What types of medications really were in the model with diabetes that really was making that assessment superior to the other methods?
Pardon, is you say the medication?
Yeah, the types of medications which were predictive in the diabetes model.
First, the use of the insulin and others different anti-diabetic drugs refers to different points in the models, such as the metformin and the others common antibiotic drugs.
So just to clarify then, it's the patients who were on insulin that had a better outcome, or those that were not on insulin had a better outcome?
Yes.
So was it the patients who were on insulin that had a better outcome after surgery, or was it patients who were not on insulin?
Our research is found if a patient didn't receive the insulin, the biggest ratio of the diabetes remission um, just if the patient didn't receive the insulin, the biggest ratio of the diabetes remission they get.
Okay, that's clear then. It's likely those patients may have had better beta cell function and been
Yes.
able to respond to the surgery more effectively. Well, thank you
Yeah.
very much.